Let's talk about monkeypox, shall we? We've all been waiting, of
Okay.
course. We have a news roundup now on the next pandemic. You know, you've been hearing people talk about what's going to be the next plandemic. I don't know about that, right? I'm not going to speak on that specifically, but
We're not planning anything.
I'm not planning anything, but you know that there's obviously discussions about perhaps even a new round of stimulus talk in a reconciliation bill as we head into August because we could see a resurgence of COVID. That could be the one thing, of course, that Democrats hang their hat on going into the midterm elections. Like, hey, Democrats got me a stimulus check, so I'm going to vote for them again. You know, that's one thing that they could possibly do. Or monkeypox specifically. Could it be COVID? Could it be monkeypox? Spin the wheel. You decide. So we've got a couple of infectious disease stories to talk about. First, President Biden this afternoon tested positive for COVID. So we want to cover that. He's been vaccinated twice.
Yes. And
Triple
boosted twice.
I think, yeah, maybe he's got the vaccine 3 times and he was boosted twice. Now, you remember last year, literally almost to the exact day, President Biden specifically last year said that President Biden last year said if you get the jab, no problem, you will not get COVID. That's what he said. Well, that didn't happen, of course. So the White House says it's not important, though, where he was infected. So they were asked specifically at the White House today about this, like why Jean-Pierre was asked specifically, hey, you know, where was President Biden infected? Like, we would want to know this, right? We'd want to know this if President Trump was infected. So where was he infected? Here's what Jean-Pierre had to say.
Where exactly was the president infected?
Where was he infected? I don't think we know. I certainly don't know if you have any thoughts on it.
Look, I don't think that matters, right? I think what matters is we prepared for this moment. I think what matters is what Dr. Jha just laid out. If we look at where we were a year and a half ago, this is a president, when he walked in, one of his first priorities was to make sure we had a comprehensive plan to get people vaccinated.
What?
Well,
what? So it's not important where he was again, if this was a Republican, by the way, there would have been news report after news report about what party he went to.
Yes.
Where he was over the past 14 days.
How he wore no mask.
How he wore no mask. He was at this event, right? I mean, I love the double standard in the press, right?
And
so,
right. And there some Republican outlets are reporting that it gets too close and personal to other people.
Right.
Right. So that would matter if he didn't have the golden touch with the media.
Like, where was he over the past few days? He was at that event yesterday on climate. Like, who was he with?
Who else spoke into that microphone, right? So, I mean, it speaks to the fact that we're not so hot on contact tracing anymore. We're not so worried about it. It's everywhere, right? But it also speaks to the fact that it still matters. I mean, even asking this question, right? It still matters how much your viral load is. If he got it from someone who he was in a car with, right, then his viral load may be a lot higher than, say, had he been exposed through the microphone that he was, whatever. These are stupid examples, but you know what I mean.
Well, I mean, and also you think about just the ridiculousness, right? I think we've now jumped the shark on this, right? But the idea that he's, triple vaxxed, double boosted, right? Wears a mask nonstop.
Triple vaxxed.
Double vaxxed, triple vax. I think he's had I don't know how many.
No, I think it's 2 and 2.
Does anyone know in the chat how many?
The
2 and
2 primary ones plus 2 boosters.
Yeah. Whose hair has he sniffed, as someone said in the chat?
That's sort of what I was
right.
getting at and trying to be kind about it.
He is a viral load, Apollo 33 says. So where else, right? So he's got all of these things, right? He's got all of these different jabs, and then he wears a mask all the time, right? The point is that just like these other flu, you're going to get it, right? You're going to get it at some point, right? So again, then the focus, of course, on even as Dr. Fauci said last week, the waning efficacy of this stuff. Okay, so now you're going to push again for it? Then why is your CDC continuing to push for it again and again and again?
Yes.
That's a real question.
But, Democrats did really well on the COVID news cycle. And so I'm not saying the president doesn't have COVID, of course, but, bringing COVID to the top of the conversation rather than the fact that jobs numbers are the lowest in 8 months. Now, right? Because Democrats continue to battle this high inflation number with the fact that, well, the jobs numbers are good, right? So if both things are not true, then they're going to have to look these inflation numbers right in the beast, in
Right.
the eyes of the beast.
So we did learn. You can take my laptop, Philip. What he's taking Paxlovid, which is the COVID medication prescribed to Biden. That's what he's to deal with this for especially for high risk people. We did learn earlier this afternoon that he's been taken off of heart medicine, the heart medicine that he was on, so as not to conflict with it. He's been taking Paxlovid, consistent with CDC guidelines. He will isolate at the White House and continue to carry out all of his duties during that time. The antiviral drug is intended for use by patients who are considered likely to become seriously ill from the deadly virus, such as elders and people with pre-existing conditions like heart disease. So they, again, proved this thing in December of last year. They were authorized to administer the drug only just 2 weeks ago. So this is new. Until early July, the drug could only be prescribed by physicians. So the other question is, so you have staff members, according to reports this afternoon, have been going in to take pictures of him just to prove that he's okay. They're releasing a video of this. So they're sending staff members in just to take photos of him to prove to the press that he's alive. I mean, it's kind of crazy. We also had the same level of weirdness around Trump, right? We had the helicopter ride to the hospital, right, and got the drug cocktail that he got there, came back, then released that video, seen him going up on the White
then
House
went on a
balcony,
joyride with his Secret Service so that people could see him.
waving
right?
and all of that, that I'm fine, that I'm good to go, and all of this. But a lot of questions this afternoon about, as a concerns for a 79-year-old. This is what people are saying. Like, he is 79 years old, and you're taking him off of heart medication to give him this, barely approved 2 weeks ago,
antiviral,
which had a lot of problems according to reports, right? And he's receiving this Paxlovid to minimize the severity of it, but they're not going to say anything more than that. This is a subvariant. Doctors saying it's highly contagious, more easily evade the protections provided by coronavirus vaccinations. So really doesn't matter at all at this point. Like, how many of these things have you been jabbed with? Because these things have mutated so much that they're not even associated anymore.
Yeah. So we planned for this talking point was just, it's very perplexing, right? Because, I plan to take care of people with COVID in my house too, with chicken soup.
We planned for this, yeah. So I won't answer your question.
With some chicken soup and some Epsom salt baths. That's how I plan for it.
I plan for this. I want to, Philip, I'm taking the mouse over here. Where is the mouse cursor? There it is. There it is. I want to play this again. So this is, we planned for it.
Where exactly was the president infected?
Where was he infected? I don't think we know. I certainly don't know if you have any thoughts on it.
Look, I don't think that matters, right? I think what matters is we prepared.
By the way, you're going to tell us what matters? Like, I'm a reporter asking the question, and then a separate reporter asks the follow-up question. Like, well, I know you said it doesn't matter, but it matters to us as journalists. Like, we're asking that question.
Well, because when President Trump had COVID, everyone was concerned, how long did he know and who else was he around, right? So if they could contact trace and say, well, he was around so-and-so, who had COVID, we know that he tested negative as recently as Tuesday. Okay, who was he around? I think that's a valid question.
Meanwhile, the New York Post has a stunning story out today about monkeypox in the United States, and it seems that the CDC doesn't know what the hell to do about it. They're so focused on other stuff, they're not even really focused on monkeypox, but you should maybe talk to CNN and other members of the mainstream media because they're really focused on monkeypox. So here's the New York Post piece from today. What monkeypox? Woman with insane rash turned away for testing. So according to the New York Post, they had pulled this piece from TikTok. A woman went viral for describing the lengths that she went to, included calling the Centers for Disease Control on the phone and prevention to figure out whether or not she has monkeypox. So she goes to her primary care physician and, they said, no, you got to call the CDC if you think you have monkeypox. We don't even know what that is. What are you talking about? So she calls the CDC and then they're like, no, you got to go back to your primary care physician. They're like, you just have MRSA. That's all you have. Just go home. Just go back home. You have a bacteria infection. Just go home. You're fine. Nothing to see here. So listen to her explain.
MRSA is staph. So
Staph
that
infection.
is serious, but okay.
She was told that's what she had. She should just go home. And get an antibiotic
Right.
and go home.
So then she calls back and actually gives them the idea. Do you think this could be monkeypox? Like, it's her that became concerned about it. Go ahead and play
go ahead and play it.
So in my mind, I know that it's not just a rash. I can tell that something's wrong. So I call urgent care and I'm just like, hey, is there any way you can test that for monkeypox? They said, monkeypox? I said, yeah, that disease that's going around? They said, yeah, we don't do that. The CDC has no idea what they're doing. Nobody's educated, not even doctors. And doctors will refuse to see you, treat you, and or test you.
Great news.
So they told her to go to a dermatologist, and then a dermatologist called her back and say, we're going to cancel your appointment because we're not going to deal with that. If you think it's monkeypox, no, don't even come in here. We don't know what to do with it. And so no. And then she called not just urgent care, not just the CDC, but also a dermatologist and her primary care. And she was like, none of them really had a plan. So yeah, that's upsetting, especially when you consider there are now reports of about 1,400 cases inside the United States. 96% of them are males. And they
don't know where to stop them too. Like, this is the other big piece of this. Like, they don't know what to do about it. They're like, okay, we don't know what to do about it. Maybe you don't know what to do about it because, apparently, and according to reports, this might not have actually just been naturally occurring in nature. It might have been manipulated once again. So now there are reports that this has in fact come or was being worked on and studied at the Wuhan Institute of Virology. Sound familiar? The Wuhan Institute of Virology is, of course, the same place where COVID started, right? And we have multiple reports about that having been escaped from that lab. And we know, we've covered this on the show, reports of those individuals working at the lab that got sick in the days before the pandemic broke out. We certainly have the Canadian military that was there for the military games, witnessing all sorts of crazy lockdowns happening there. So the evidence is overwhelming on Wuhan lab, right? Well, now the Wuhan lab manipulating and studying, working on the monkeypox virus specifically. Here's Dr. John Campbell explaining the data on this. Watch.
Now, the main thing we're looking at today is it turns out that the National Institutes of Health in the United States and the Wuhan Institute of Virology have both been working on monkeypox, coincidentally, before the outbreak that we are currently experiencing. And I kid you not, this is from the Institute of Virology in Wuhan. This is where this research on monkeypox is being carried out. So the Wuhan Institute of Virology is working on a test to test for the presence of monkeypox. And I think we could assume they're interested in tests for smallpox as well, bearing in mind this is a potential biological warfare agent.
Wait, I'm just going to pause it there. Oh, bearing in mind that this is a potential warfare agent, a biological warfare agent. Just bear that in mind as we continue.
If you're already starting to feel uncomfortable, join the club. I'm actually very uncomfortable about what I'm about to tell you. So that's the name of the paper there. Efficiency of a large-scale fragment of monkeypox virus. So basically what they're doing is they make a section of monkeypox virus. And they want to use that as a quantitative polymerase chain reaction template. And they're going to use this way to put it together into a yeast. Now, direct quote from this paper. Since monkeypox infection has never been associated with an outbreak in China, the viral genome material required for PCR detection is unavailable. So the Chinese authorities, it would appear, are incapable of getting hold of monkeypox virus. So they have to basically make their own using synthetic techniques, or make a part of the viral genome themselves using synthetic techniques.
Okay.
Sound familiar?
So they made themselves up a synthetic pot to work with. He later goes on in this video to say, I don't buy that. You could have taken a scrape off of anybody. There are hundreds of cases in the West and thousands in Africa, and had it shipped, although again, shipping viruses around. I'm not sure how comfortable we all with that, but this does happen, right?
Right.
And so that doesn't seem like a very good excuse for them to have like brewed up a pot.
A pot of monkeypox that they're making. I mean, how many people feel okay with that? And by the way, again, the reason that we have this bizarre behavior, of course, with COVID is because it was man-made.
Yes.
Right? When you manipulate it, when you
Yes.
manipulate it the way that you do, and and the gain of function research that was done, right? The reason that it's had all these major problems, we've had this mutation of it in such a way, is because it was made in a lab.
Yes.
It was not naturally occurring. It was made and manipulated in a lab.
So, if you read the paper that he cites here, it cites several labs in China, including the Wuhan lab, and they sort of assigned this to themselves, right? And they started way back in February. So, yeah, it's not confidence boosting at all.
And never mind the fact someone points out in the chat here, Gabriel says 40 biolabs in Ukraine. By the way, where we know they were doing this type of research, they were doing gain of function research in Ukraine. So all of this stuff comes together, and it all comes together in interesting ways.
Thank you so much for subscribing to our channel. We've been banned, we've been blocked, we've been censored. That's why we started our own website, to stay connected with you for free.
That's right. So head on over to redacted.inc and make sure you're connected with us. You can sign up again at redacted.inc, not .com.